part of the thing about being a life coach is realizing the best way that we can contribute to the world that we live in is to be authentic. I have been doing doula work and life coaching for a combination of about 17 years. I started out working Trisomy 18 Foundation in America, and it became an international organization. We worked with families facing adverse prenatal diagnoses, and that's where I started my career. And I was their first support director. I then went on to train as a high-risk doula, and I've supported, between those two locations, I've supported over 6,000 families around high-risk birth. So adverse prenatal diagnoses, previous loss, things like sexual abuse, coming to pregnancy after sexual abuse. I've had clients who are LGBT. I've had all sorts of mental health and physical health realities that people have dealt with. So that's been a huge background for me. And that's been a really big part of what's drawn me into the work that I do. But a few years ago, for some health reasons for myself, I sort of made a transition and went back and did some training as a life coach. And so now bring all of those pieces of high-risk doula, pregnancy support, life coaching into the work that I do. And so whether it's pregnancy issues, parenting issues, partnering issues, I've also got a lot of experience around disabilities because myself and my children all have disabilities. My kids both have autism and a neuromuscular disorder. So we use wheelchairs in our house, we use sensory rooms in our house, and everything in between. And so it's meant that I've really had to force myself to learn sort of the edges of how to parent, how to respond in my marriage, how to succeed in terms of partnership issues and personal issues and all of those things. So a lot of growth over the years in all of those areas. The upshot of it is that I am feeling, quite excited about what I have to bring to clients these days because as I call myself a canary in the coal mine. I notice the things that aren't working way before other people do, and it means I've had a chance to come up with some really unique strategies and solutions. So before we get started, I just want to take a minute to give two little housekeeping announcements. The first is that I'm going to intentionally use gender neutral terms today when referring to birthing people or birthers and their supports. As a doula, my practice is fully supportive of all individuals and family styles, and I want you to feel like there is a safe place in this conversation for you, wherever you are coming from. Secondly, us birthers often come to birth with our own hard experiences. We've been through things that shape the way we understand birth and the way that we experience the stories, supports, and strategies available to us. Unlike most childbirth education classes I teach, I have no way today to see you, and so I can't track how things are settling for you. So I wanted to start by letting you know that if anything I say feels like too much, or you need to feel like you need to step away for a bit, or just quietly leave the call, that's okay. Your first priority is to look after you. I hope, however, that if you feel the need to do that, you might get in touch with me later on through Sofia Health or with someone else you trust to talk through how you are feeling and what made you uncomfortable. I promise, as hard as these conversations can be, there are things we can do ahead of time that can make your birth so much better. Before we can plan for birth, we need to think about what kind of birth we are planning for. Some of us automatically plan for a calm, peaceful, gentle birth, maybe in a hospital or a birthing center or even at home. We assume that everything will go well and that there's no need to worry or plan for anything to go wrong. We might even plan to have an unassisted delivery in the firm belief that birth does not need to be medicalized because we were designed to do this. And that's great. But others of us automatically plan for an excruciatingly painful birth, starting with our water breaking in some high-stress event, followed by a pell-mell, high-stakes adrenaline rush to the hospital, lots of interventions, screaming, and, if we're lucky, a beautiful, healthy baby at the other end. It's not your fault if that's what you're planning for. That's the quintessential Hollywood birth. That's what we've been fed. The reality of birth is usually somewhere in between the one and the other. Although I've been a high-risk birth doula and therefore worked with some of the most challenging birth situations imaginable, I have been present at a number of extremely calm, gentle, quiet home births, as midwife-assisted home births are legal in my community. I have also had a couple of very quick, mad dashes to the hospital, one of which only just managed to not result in a birth in my vehicle. But most of the births that I have attended, the vast majority, in fact, have existed somewhere in the middle of those two extremes. So before we can plan for a birth, we need to make sure we're planning for the birth we're likely to have, not just the birth we want or assume will happen. One of the biggest challenges to come for birthing people during COVID has been the loss of supports before, during, and after birth. Because of policy decisions for supports are being made on a per hospital basis, and these decisions keep changing based on regional COVID levels, many birthing folks are finding that they can have their partner, but not their doula or their additional support person present. And some are finding they are birthing on their own. This creates an added level of complexity as we approach birth and means that our preparation for birth as a birthing person is that much more important. So what can we do to prepare? Today, I'm going to give you a few really basic tools. While these tools are critical to birth itself, you may actually find that they are helpful in all areas of life. To start with, we need to know ourselves a little bit better as birthing people. How do we generally cope when life gets tough? When we're in pain or feeling stress and tension? What generally makes us safe? Now, those are two separate questions. So if you mentally take a second here and circle the answers that you see in front of you on these two screens, to just circle what makes you feel safe and how you tend to cope. Often you'll find that there's a little bit of a disconnect between these two things, because the ways that we generally reach for to cope aren't always the same things we find make us feel safe. So for me, I tend to be a distract myself kind of coper, a withdraw, panic, and ignore. Those tend to be some of the ways I cope. But in the things that make me feel safe are being held, knowing that I have a safe person with me, being with someone else. You can see how those two things, like they're not in agreement with each other. There's a tension between them, right? And so our first goal in our birth plan is going to be to create a connection between what makes us feel safe and what coping strategies we actually want to use. Some of this will need some creativity to achieve, especially if our safe person can't be physically present with us at the birth because of COVID. And if you need someone to work that through with, I would be more than happy to do that work with you. But for now, just observe the differences if you're able. Let's talk about supports. In an ideal world, we would be able to bring some safe people with us for our birth, and we'd be able to talk with those safe people ahead of time in terms of how we want and most value their help with a tool like this. One of the most critical jobs for a birth person with their support is to communicate as clearly as possible and to be able to talk to them ahead of time about what we think we might need. Because although many of us hope our partners and supports can read our minds, the reality is that is rarely the case. We may also want to remind our supports of some very specific, helpful things they can do during labor and pushing stage to help us cope with what's going on. Supports typically do best if they have this clear information, as it allows them to show up knowing their importance and feeling confident in their responsibilities for what is often a nerve-wracking day for them as well as for us birthers. If for whatever reason one or more of your birth supports aren't able to be present with you at the birth, some people are finding that a phone or video call using speakerphone or headphones can be of some comfort to both birthers and supports. Their role and presence, even virtually, is still important to you in this moment. So try to create a birth plan that includes contingencies for if someone is sick or otherwise unable to attend. So now that we know ourselves a little better and know the role our supports might take, let's turn our attention to what is probably the thing that people are most concerned about going into birth. How will you deal with pain? I want to start by taking a minute to talk about the fear, tension, pain cycle. If you're able to comfortably do so, I want you to take your arms and clench them really, really tight. Put them up near your face and clench them up really, really tight. That's right. And then I want you to clench your shoulders, your elbows, your wrists, make your hands into a fist. Clench them really, really hard. Are you still clenching? Is it starting to get painful? Yep, that's what we're going for. That's okay. Now, still clenching, I want you to try to move your arms out to the side. Remember, your shoulders are clenched, your elbows are clenched, your wrists are clenched, everything's clenched. Now try to move them out to the side. Notice how challenging that is. Notice how much extra pain that puts on you. Okay, now you can relax your arms, shake them out, take a few deep breaths. When you feel like you've recovered your breath, I want you to just move your arms. No clenching, just repeat the same position as before, but without any clenching. And then with your arms nice and relaxed, just move your arms in and out, right? See, the brain naturally has this process that says, if I'm tensed and clenched, I'm doing more work. And that work results in pain, and that pain results in effort that then it just sort of spirals. Instead, what happens as we do that is we understand this as scary. This pain is connected to fear. And so, because so much of the pain we experience in life is truly dangerous, that's like a reasonable thing for our brain to give us as a thought process in general. The problem is it has so many impacts. It tenses the muscles, it prepares us for fight or flight, it elevates our blood pressure, our heart rate, it slows our digestion, and more. Unfortunately, the system isn't super great at discriminating between good pain and bad pain. And so we end up responding to labor pain with the same fear and tension that we would respond to any other painful experience. The result, frustratingly enough, is that we end up in more pain than we needed to be in. So how do we get out of the cycle? When we lower our fear, it lowers our tension. When we lower our tension, it lowers our pain. When we lower our pain, it lowers our fear. The cycle is broken, and instead of becoming increasingly tense, frightened, and in pain, we're able to be mindful, connected to our bodies, and present for the birth of our child or children. And you may reasonably reply, that's great, but how am I supposed to do that when I'm in labor? Completely fair. Well, we all know that there are drugs available for pain relief during childbirth. And there are times and places for many of them. I want to just take a little second and just affirm that there are really good and important medical reasons for using pain medication. That there are births that would not be able to happen physiologically without pain medication being used. And a lot of my clients have needed pain medication for various reasons to be able to have the vaginal birth, or indeed the healthy, safe birth by cesarean that they needed. So I want to just really emphasize the fact that using the right medications in childbirth can be a really healthy and helpful thing. Unfortunately, there are also times when they're just not available to us. Like before we get to the hospital, if the anesthesiologist is taking a long time to get to us, or if we have certain medical conditions that mean that these medications aren't options for us. So during our short time today, I want to spend a couple of minutes just going through some non-medicinal comfort measures so that you have those available to you if you need them. Some of these are quite self-explanatory. Resting and relaxing makes sense. Vocalization, that's like making sounds, but we want to make sure that the sounds stay nice and low, down in our throats, like instead of ee. I don't know whether you could see my throat there, but when I went everything relaxed. And when I made that higher pitched sound, which I won't do to you again, everything tightened up in my neck. And if you're wondering, sit in front of your mirror for a second later on and try that out. Try out different sounds and see what it does to your body. See what it does to relaxation. And remember, you're trying to find ways to make sounds that let some of the tension out, that reduce your tension in your body, not increase it. Then we're looking at deep breathing, taking a shower or a bath, using hot or cold compresses. These are all things we mostly know how to do. Hopefully, when you were looking at the things that made you feel safe earlier on, you'll know whether encouraging words would be on your list of things you'd benefit from, or whether they'd be on the list of things you'd want to slap somebody for. Everybody's different, and that's okay. But what about the second side? These things are a little bit more complicated. Positions, especially upright positions, can make a really big difference in labor, which surprises a lot of people. Most of us instinctively want to lie down, roll into a fetal position, and hope that it'll all be over soon. But if we can take the mental risk of standing up, leaning over a chair, squatting supported by the back of a chair or a window ledge or a bed, or using a birth ball, we might find two key things change that make us far more comfortable. Number one, our upright position will make us mentally feel much more in control. When we feel in control and feel like we have agency, we experience less fear, which in turn makes for less tension and less pain. Baby's position inside of us is number two, because as we stand up, baby's position inside of us will create a much better connection with the cervix. That in turn will make each contraction more effective, which in turn will shorten how long labor is going to last. No one can tell you how many contractions you're going to have, but you will have fewer contractions and they will do more effective work with each of them if you are standing upright or squatting than they will if you are lying down on a bed most of the time. So this is especially true if you're experiencing your contractions in part or in whole as back pain. Back pain in labor indicates that baby isn't in the best position for birth. And if you can get on your hands and knees for about 20 to 30 minutes, about 5 to 10 contractions, or lean forward onto a window ledge or a counter during 5 to 10 contractions with your legs about shoulder width apart, you'll reduce your overall pain, the length of labor, and some of the interventions that come from birthing a baby sunny side up, because baby will actually be able to turn just a little bit more and get into a better position where baby's head is touching the entirety of the cervix. There's so many complications that can be avoided just by using that one intervention early on in labor, far before you go to the hospital. This is very effective if your contractions are coming sort of irregularly in that 5 to 7 minutes apart zone, and you're just getting a lot of back pain, especially in between, continuing in between contractions. And it's one of my little secret superpowers. Other options that can help are massage, either very firm pressure or very light effleurage. If you're looking at the screen of the video, a light effleurage is just like running your fingers over the skin very, very lightly. And someone can use that, especially in time with a nice, slow, deep breath, and that can be very calming. Sensory distractions like dimmed lights, nice smells, soothing sounds, movement, things like going for a walk in early labor or gently rocking back and forth with your arms over your partner's shoulders in later stages of labor can also help. Unfortunately, the last item on this list is a rebozo is often something you need a doula's assistance with, but feel free to look up rebozo in labor. If your partner or birthing support is open to it, you may find that that's a support that you can either do with an actual rebozo if you can get your hands on one, or you can kind of modify it a little bit with your birth support's hands. If they put their hands up and underneath of your belly, they're just sort of going to latch their fingers, interlace their fingers like this, and pull up on your belly just a little bit. Because often towards the end of labor, our bellies get so big and so round that they kind of almost tilt forward of our pelvis. And by bringing it up and into position and supporting it a little bit, it takes some of the pressure off of our back, and in turn allows, again, for baby's position to be much more effective. We started with the assumption that we need to plan for the birth we actually were going to have, and not just the birth we hoped or feared we were going for. As such, it's really important for us to know what to do when things take a shift. But since we've already talked about the idea that control and agency makes such a difference to having our best possible birth, just because the story changes doesn't mean that we want to automatically give up all of our agency, right? So these are some basic questions we want to ask when something changes. When your doctor or nurse or midwife comes in and says, we want to start by being really clear on what it is the caregiver wants us to do. Often this is something our supports can help us with. Want to take time to actually understand, we need to put in this IV. We need to do a vaginal check. We need you to move to a hospital. We need to consider a C-section, whatever it is they're saying. Then we want to know why they want to do it. Fine. You think we need an IV. You think I need an IV. Why? What's that going to do? Often, once we know that, we need to take a pause, and there's an unwritten statement between numbers 2 and 3. And the unwritten statement is, how do you feel about this? How do you feel about this intervention? How do you feel about this IV going in? How do you feel about the idea of moving to the hospital? How do you feel about having a C-section? It's important to acknowledge your own desires and your own feelings. It's okay to take a deep breath and think about it. There are only a couple of instances where you don't have time to pause and think for a minute or two. Collect your breath, finish your contraction, think about how you feel about what it is that they're saying. Then you can ask, what will happen to birther or baby if they don't do it? What are the risks of doing it? And are there any alternatives to this action? These 3 questions, taken together with your own feelings, gives you the opportunity to maintain your sense of agency, autonomy, and control in the situation, even when decisions have to be made that you would prefer not to be faced with. Even though this can feel like a lot to do in the moment, especially trying to negotiate alternatives with the doctor, nurse, or midwife, this can be critical to your emotional well-being during and after the birth. So what can you expect from this process? Sometimes it turns out there really is no option. It's literally do or die, but at least now you know. More often, the procedure is simply policy at the hospital. They have it there because lawyers want to protect the hospital from lawsuits, but sometimes you can ask for a compromise. And sometimes it's simply being offered at this time because someone is going off on break or shift change is coming, and they don't want you to need it while they're gone or otherwise occupied. Often in these cases, it's perfectly fine to agree to wait, as long as you understand how long you might be agreeing to. But knowing which of these scenarios you're dealing with can help you to evaluate and own the decision you ultimately make. In North America, today, the C-section rate is as high as 30%. In some parts of America, it is actually higher than that. Although the World Health Organization suggests that only 10 to 15% of births require C-section, there are a multitude of reasons why that is different right now. And in our short little training today, we aren't going to have time to get to all of those reasons. However, I do want to talk about some ways that you can create the best possible C-section experience if that's something that you're looking at needing in your birth, whether it was something you planned for from the beginning or whether it's something that becomes part of your birth story at the time. Before we do any of these other things on this list, the very, very first thing we can do for the best possible C-section is we can take a deep breath and say, my first job as a birther is to look after myself and my baby and make sure that my baby is born as healthy as possible. Sometimes this is the only option. I had a vaginal birth, I had a C-section, and I had a vaginal birth after cesarean. I've had all of the options. My C-section was just as important a birth as any of the other births, and it was exactly the birth that that child needed me to have. The very, very first thing we're going to do is we're going to give ourselves grace. And we're going to remind ourselves that we are not a failure as a birther just because that baby didn't come out vaginally. Secondly, you can ask to have your partner be in the room for the procedure in general. Now, if you'd asked me a year ago, I would have told you that you probably didn't even need to ask this question. It had become pretty standard policy in most hospitals. But with COVID, many hospitals are doubling down on infection control procedures, and it's making it much harder to have your support in the room. It never hurts to ask all the same. Secondly, ask if your support person, or if they're not allowed in the room, a member of the OR staff can take a photograph as baby is born or as soon as they lift baby from you. These photographs can be particularly precious memories if your support person isn't able to join you in the OR, or if you and your babe need to be separated for a bit after the birth. Provided the baby is healthy at birth, you may ask if your support or a nurse can support you in holding and snuggling baby, even during the remainder of the procedure. This early skin-to-skin contact can be precious in your bonding and is worth asking for. If possible, request help from your support to hold your healthy baby close to you, help you to hold your baby while you are in the recovery room. Depending on what anesthetic was used and how much numbing you experience, you may or may not be able to hold your baby for yourself, but it doesn't mean your baby can't be close to you or even skin to skin with you, provided you have support. When both you and baby are ready, ask for assistance in finding the best position for initiating breastfeeding or chest feeding if that is something you are interested in doing. Finally, if possible, ask for permission for your support person to spend the first night at the hospital with you. Their job is to fetch, carry, and change baby. Your job is to rest, recover, and feed baby. Although COVID has made many of these things, in fact, all of these things, more challenging, they remain worth asking for, and they continue to create better long-term outcomes for those who birth via C-section. One additional note for C-section births. If you're able to arrange for in-home help ahead of time for after your birth from a trusted individual, preferably someone who will come and stay with you within your bubble for a week or more, to help with caring for you, looking after the house, caring for any older children, this can make a big, big difference to recovery and bonding, even if you aren't able to check very many of these other boxes off of your list. I'm going to make these final 2 sheets available, but I want to use them to highlight a few of the extra tools I suggest birthers go through prior to birth to ensure their best possible birth outcome. First, if there is anyone in your life who is unsafe, it is important to make it clear on your birth plan that that individual should not have access to you or to baby. Hospitals have policies in place that can help protect you and baby while you are there, and it's very important that that gets listed right at the top of the page. They will thank you for that. After that, we have a number of strategies that birthers have found helpful during labor and delivery that you can sit with and consider. Would this make me feel better? Would this give me more agency and autonomy? Would this make me feel safer? If so, you might want to incorporate these strategies in your final birth plan. Remember, you are the one birthing. This day and this process is about you personally. It's about your body and your baby and your family. So it's important that you take up some space, that you have as much agency as possible, that the things that matter get considered in that room. Although many of us, maybe even most of us, find ourselves wanting to make the people around us happy during labor, it's important to remember that this isn't their body or their big day. It's just another day at the office for them. Your baby's birthday will be your big day. And the way you, your body, and your baby are treated will be part of setting the stage for your feelings about your body and your baby and yourself moving forward. So this matters. Even if you think that some of the things on this list feel like you're asking too much, if there are things you would like, it's better to ask than to keep quiet. So then if you look on the packing list, you'll see a couple of other strategies that can really help make your birth the best, even though you don't need to officially include them in your birth plan. Things like wearing clothes you brought from home rather than a hospital gown, and bringing a laundry bag so you can easily deal with any soiled items as you go can make a lot of folks feel much more comfortable and at home. The same goes for slippers or Crocs or flip-flops. Although at the moment, I would definitely discourage the slippers and go for the Crocs or flip-flops. They're cheap, they can easily be sanitized when you're finished, or indeed they can just be thrown out. The happy body bag is another way of looking after your body and feeling as calm as you can. This is where you put the things that make you feel calm. Lotions, lip balm, sensory tools like a squishy ball or a bumpy ball, massage tools, a hot pack, whatever makes you happy. Now, I'm a huge fan of breastfeeding whenever possible, but only you can decide whether that is the right decision for you. By the same token, for some birthers, having babe up against their chest is a wonderful experience that they love, and for others it is a highly unpleasant experience or even upsetting. If this is you, consider some alternative options for feeling closely connected with your new baby. Perhaps holding your naked baby on top of you while you have your top on, with a blanket over top of them for warmth, or holding them skin to skin on your belly might provide the same warmth and attachment without the uncomfortable associated feelings. Whether it's this issue or something else that you've been thinking about as you prepare for birth, the more you can be honest with yourself ahead of time about the things that make you comfortable and, more importantly, uncomfortable, the better you can come up with creative solutions that will help you feel prepared and in control the day of your birth. And if this or any other element of what we've talked about today has been hard to think about, I really encourage you to reach out and make an appointment. Whatever the reason, and without having to get into it, there is work we can do ahead of time to help you feel safe, calm, and ready when it comes time for baby's arrival. Finally, I want to draw your attention just briefly to the word depends on this packing list. Although no one wants to use these in general, they can be very good for absorbing things like amniotic fluid once your water breaks and your first few days of bleeding after baby is born. Especially when you're lying down or shifting positions, these bodily fluids can make a lot of people very uncomfortable. And I find that Depends or their equivalent are one of the most effective options.
Is the husband allowed in the room during a C-section procedure?
Pre-COVID, the answer was almost always yes. Um, Husband, partner, first support person, whoever they were, was allowed sort of at the head of the bed, sitting on a stool beside you behind a drape. So they weren't seeing what was actually happening on the other side. They weren't encouraged to look on the other side, but they were allowed to sit beside you, rub your cheek, be present with you. And they could sometimes hold baby right up next to your chest, right cheek to cheek while the procedure was being completed. Unfortunately, now we're hearing really mixed answers to that question, depending on where you are in the world, in North America, in the States especially. So it really depends on the hospital's infection control procedures right now, whether they're allowed or not. And I'm hearing that more often than I would like that partners are being excluded from those birth rooms. In terms of just the general birth room, just as an aside on that, what a lot of times is happening is that partner is allowed to come, but partner is required to stay in the room with birther, and everybody has to just stay in the room for the entire length of time that they're there. So that shifts it from, oh, I can just send my partner out for some food when he gets hungry or she gets hungry. Now there's no in and out privileges. So doulas are really suggesting pack like you're going camping. Bring everything you possibly could need for while you're going to be there, and do that for long enough for, like, if labor takes a while, if it's 20 hours, if it's 30 hours, like, make sure you have everything you need for that entire process for you and whatever supports are coming with you.
I had a doula for my first birth, but she did not help me ensure my birth plan was followed by any of the nurses or the midwife. How can I better screen a doula in the future to make sure she follows my birth plan? Or was this just a unique and poor experience?
There's a couple of points here. Doulas have varying levels of experience. It's always worth asking a doula how many births she's been to, what kind of experiences she's had in those births, because there are doulas getting newly trained every day, and a lot of the training that a doula ends up with is really learned on the job. And so a newly certified doula is going to have limited experience in terms of how to help use her voice. The other piece of that is, though, I usually tell my clients, your birth plan is really between you and me. It's not something that either one of us, can enforce with the hospital. It's something that helps us to give a direction for how we know these are the things that matter to you. These are the things we know you want in the birth. And these are the things we're going to work towards to the best extent that we have. But it's not a prescription, and it's not something that we can control. And sometimes you end up in a situation where the hospital staff is just not amenable to the things that you're asking for whatever reason. And so in that instance, what I want from a doula myself, and what I hope to bring to my clients as a doula, is just a sense of, like, the well-being. We make a little bubble between us, and this is the well-being bubble. And in this bubble, the things that matter to you, your priorities, these are the things that we're going to focus on and try to make sure that you get as much of as possible. And then whenever we interact with staff, whenever staff comes in and says, well, we need to do this, we need to do this, we need to do this, the doula's job in those instances is to help you as the birther say, do I have to have that done? Why does that need to be done? I was hoping I could do this instead. But those comments, they have to actually come from you. A doula can't say to staff, her birth plan says this, therefore you have to do that. We don't have that kind of authority. Sometimes a support person like your partner, your husband, your wife, whoever, sometimes they can say that. It's really important to the birther that this happens, but doulas can get in a lot of trouble if they try to do that. So it's sort of a bit of a balancing act there. Yes, a more experienced doula should have some strategies to help you advocate for yourself and should have some ways of bringing things up sort of, around the side and effectively supporting your goals. But also at the end of the day, they're not allowed to tell staff what to do.
As a new mom to be, I have no idea what to expect for birth delivery or have any idea where to even research to see what's best for me as a birthing plan. Where do you start on this journey?
When I work with clients, and I still do work as a doula, I work primarily in the prenatal and postpartum phase. Obviously, I don't attend births as much. I use a power tilt wheelchair, and so that's not really a space that I can be as helpful in as I would like anymore. But one of the big things I do really early on with my clients, even worked into my childbirth education programs that I do for people one-on-one, but also even to one side of that is figuring out, like, what is it you want? What's important to you? And what does that look like in terms of strategies and themes and support ideas? Where can we start? Because unless it's rooted in who you are, unless it matches up to your values and your health and your situation and circumstances, then it won't be a good birth, even if you read about it and the person who told you about it said, oh my goodness, my birth was fantastic, because that won't necessarily translate into a fantastic birth for you if it's not rooted in who you are and your own circumstances. So for me, as a practitioner, it's very important to me that people have the chance to understand themselves really well and then plan a birth that makes sense to their unique situation, which is why I always do childbirth education one-on-one. I don't do classes, because in a class environment, you can't always ask all of those questions. And it's just so much more effective to be able to have that deeper one-on-one conversation.
So, for someone who doesn't even know where to begin, this is where Sophia Health actually comes in, right? They can get online, go to our pregnancy category, and have the one on one consult with somebody to say, where do I start?
Yeah,
Right.
exactly.
I know you were doing this presentation because you said there's a lot of free childbirth classes and education out there that actually was canceled because of COVID. And
Mhm.
so are there other educators?
Yeah. So I mean, I think meeting with any educator that you feel comfortable with will potentially be helpful, but you want to make sure, like some educators, they just have a rote book and they want to just give you the rote book. This is their view of how birth should happen. As a high risk doula, I say, well, that's great, but how does that work for this person with this condition, this person with this experience, this person with this past, this person, So for me, I want to look for a childbirth educator who understands the complexity of birth and is going to help me figure out what my priorities are and how I can best act on those priorities in the shifting experience that is birth.
Of all the comfort techniques you mentioned, are nurses trained on any of these? I had a friend and my doula do hip squeezes, but can I expect the same support from a nurse?
No, sadly. Nurses are trained in how to give medications and how to chart And they're actually pretty darn good at catching babies in a pinch if the doctors don't get there on time, but they are not trained in general in terms of these non-medicinal comfort strategies. So that becomes a real issue if you're not able to have a support in the birth room.
I'm planning for a birth with minimal medical interventions, but I know things don't always go to plan. If it progresses to a C-section, are there things I can do to keep it so as natural as possible?
I just want to start by saying you are doing such a great job, even just in envisioning your birth, by the way that you couched that question. That is just such a positive way to think about it. I love a minimally intervention birth. They are some of the most beautiful memories are those births. But I also have had some really, really beautiful memories in C-sections with clients. And often the biggest thing is just knowing that the first job is healthy mom and healthy baby. That's the first job. And that alone is going to make it feel much more natural because it's going to feel much less conflicted. A lot of what happens in a C-section that makes us feel bad afterwards is this sense of, I was a failure. I did a bad job. I couldn't birth my baby. And that's so far from the truth. So I think the first thing is just grounding yourself in that reality that if you need a C-section and if you have prepared as well as you can, been supported as well as you were able, had as many non-medicinal options as possible to reach from, that you're going to be able to look yourself in the mirror at the end of the day and say, I did a really good job birthing this baby. So that's number one. Number two is, if you're able to have a support in there with you, ask for them to hold baby right up to your chest and right at the very, very top here. So it's going to be basically like your cheek and the very top of your chest. Everything else is going to be draped and covered. You're not going to have access to it. And your arms are going to be out on the sides and usually actually strapped down. So you can't use your hands. This is hard. People do not like this. But if you can have somebody put baby right up there, and if you can just breathe in your baby, breathe with your baby, feel their skin against you, that's going to be a really healthy experience for you and baby. And that's going to help reconnect you and get that bonding started. If for some reason baby has to be taken separately to a NICU, then that gets a little bit harder. But really, your goal is attachment at every single moment, is attachment and calm presence. And so whenever you are next able to hold baby, see baby, your goal is just to be present. And so anytime you can skin to skin, breathe with baby, sit with baby, just breathe that baby in. That's going to help you to reattach from that separation.
If you don't have the scope or the authority to tell the medical staff anything, what can you expect from your doula?
So, in terms of expectations from a doula, I would want to meet with a doula a minimum of 2 times before my birth. And during those 2 times, I'd want to make sure that she knew, what was important to me in my birth, what my birth plan was. I'd want to be really clear from her on what she thought she would bring to it. In the doula groups that I'm a part of, I see a wide range of responses in terms of what people think they're responsible for. For me as a doula, I'm on call for my clients from the time they sign with me until they give birth, because I work
Wow.
with high risk clients. And I've had clients give birth as early as, well, I've had a couple of late stage miscarriages at 14 and 19 weeks. I've had premature births at 25 weeks who survived and are now thriving and doing amazingly well as like a 10-year-old. She has a little bit of a limp on one foot. Like that was cool. And I've had clients in and out of hospital with high risk issues. So I personally, because of the work I do, I'm on call for a lot longer. A lot of doulas won't go on call for you until 37 weeks. So you need to be really clear, like what happens if you go into labor earlier? What is their policy? How does that look like? And you need to make sure that you're comfortable with that level of support. And then some doulas will also provide childbirth education. Some doulas will recommend a childbirth educator for you. So being clear on like who's responsible for what. And then how early in the labor do they want you to call them? And how early during labor will they show up? So some doulas won't show up until you get to the hospital. Some doulas will come to your home early on in labor and provide support. Personally, that's the side of things I kind of lean to, but you might have picked up that I have this very high touch sort of approach to the work that I do. And I think it shows in the clients that I have in their experiences. So you need to know what's important to you. Do you just want somebody at the hospital with you, or do you want somebody who's there for much more of it? You need to check to make sure that they have a backup doula. So if they're sick, if one of their kids is
Oh,
sick, if
that's
something
good.
happens and they can't get to you, is there somebody else that's coming? You need to check how long they'll be at the birth for. So do they have a maximum number of hours before they'll trade off with their backup doula? Or are they there until you're done? Different doulas have different policies on that. And then how long after baby is born do they stay at the hospital with you? Most doulas, I don't know whether I can say most doulas, I typically would mentor a doula to stay at least 3 hours after baby's born. It takes time for everything to sort of settle in, and you just need someone to reassure you and help for a little bit. That's fine. A couple of scenarios where I would want a doula to stay longer. If I have a very, very fast birth, so I had one client who birthed in less than 45 minutes from first contraction to baby in her arms. I spent about 6 hours with her after that birth before I left, because her brain had not caught up to the fact that she had had a baby yet. And she really needed some extra support for that. And then if you're having a planned C-section, I would talk with the doula, because I've had situations where I was hired on purpose for a planned C-section. Dad was there for the actual C-section and the birth, but they had another little one who wasn't very old. She was less than 2. And dad went home to be with little one for the first night. And I was hired to stay the night and be that one-on-one support for mom for the first night that they were in the hospital. So different doulas will have different policies there. And then post birth, what supports does the doula provide for breastfeeding, or for dealing with your milk coming in if you're not planning on breastfeeding? And how long does she track with you? How many visits postpartum do you get with her before she's done? So it's really important to be really clear on all of those aspects. And if you're looking for a postpartum doula as well, is that something she also offers? Can she take you forward into the postpartum period? Because usually a birth doula will only visit maybe once in the first week and maybe one more time. More than that, you would usually need to hire someone as a postpartum doula. But that doesn't mean you can't. Again, knowing what it is you want and then knowing whether this doula can provide that at the same time is really important. If I can just leave you with the
Yep.
knowledge that, if I can do anything to be helpful, anything I've said sort of sparked something. This was a really, really bare bones. Usually when I do childbirth education, it is 6 hour-and-a-half long sessions. And we go into a lot of details, and there's a lot of back and forth. So if you feel like I missed something, I did.
Yeah.
That's okay. If you're still a little bit confused and you're not quite sure how to do your birth yet, that's okay. That was expected, but know that I'm here. Would love to meet with you guys and support you as you go forward into your big day. And to all of you who are expecting right now, all the best. I really hope that your birth is a beautiful experience for you.
You guys have any questions or want to get in touch with Heather, she's on Sophia Health. Heather, thank you so much for joining us again. You pack so much good information into these Q&As, and people have such wonderful questions.